Good evening and welcome to the second of our fall Your Child's Health University lectures tonight. So we have two lectures tonight, Dr. Rebecca Ryalan-Berry and Dr. Sano Zak. Dr. Berry is a licensed psychologist with experience in the evaluation and treatment of anxiety, ADHD, and disruptive behavior disorders in children, adolescents, and young adults. She provides comprehensive treatment to families, including cognitive behavior therapy, dialectical behavior therapy, and behavioral parent training. She coordinates the Stanford Behavioral Parenting Skills Program and is active in providing behavioral and mental health consultation to schools, teachers, and community providers. Dr. Berry teaches a psychopathology course in the PGSP Stanford PsyD Consortium program and is involved in the teaching and training of Stanford psychology interns, postdoctoral fellows, psychiatry residents, and second-year psychiatry fellows. Dr. Berry has extensive experience providing evidence-based treatments for social anxiety, generalized anxiety, separation anxiety, selective mutism, panic disorder, post-traumatic stress disorder, obsessive-compulsive spectrums disorders, as well as tics, trichotillomania, and other post-traumatic stress disorders. Her research interests include school-based mental health interventions and the development and dissemination of innovative psychosocial treatments for anxious and trauma-exposed youth. Dr. Berry received her PhD in psychology from Columbia University in New York City. She completed a clinical psychology internship at Lucille Packard Children's Hospital at Stanford and the Children's Health Council in Palo Alto, and a postdoctoral fellowship at Stanford University School of Medicine, Department of Psychiatry and Behavioral Sciences. Dr. Sano Zak is a clinical assistant professor in the Department of Psychiatry at Stanford Medical Center. She is the assistant outpatient director of Lucille Packard Children's Child and Adolescent Psychiatry Clinics, the director of the Stanford Dialectical Behavioral Therapy, or DBT program, and co-director of the Early Life Stress and Pediatric Anxiety program. Dr. Zak's clinical work focuses on adolescent mood disorders and trauma in women. She received her PhD from Pennsylvania State University College of Medicine, PA. She completed an internship at Beth Israel Medical Center in New York and a fellowship at Stanford University. So please join me in welcoming our speakers tonight.
Thank you for that introduction, Felice. It's very nice to be here. Thank you all for joining Dr. Zak and I on this lovely Monday evening. So our discussion today will involve two parts. First of which will cover anxiety disorders, or how to recognize anxiety in your teenagers. And the second part, which will be covered by Dr. Zak, will focus more on identifying and working with teens with intense emotions and more mood disorders. So we wanted to combine these two discussions because we often see these conditions present separately, but often they do overlap. So we hope that you find some benefit in that. Ultimately, what we'd like to provide you with is some reliable and practical information as to how to recognize any of these difficulties in your own teenagers and to empower you to work with your teens, and also how to get help if that's applicable for you. So how many people in here, and you don't have to raise your hand if you don't want to, have a teenager who you would consider to be a worrier? So I wanted to ask how many of you yourselves consider yourselves to be a worrier as well. Okay, what are some of the things that teens worry about? Go ahead and shout them out if you have any ideas. Grades, it's a big one. Friendships. What else? Social acceptance. What makes teenage worries different from our adult worries? We'll get to that a little bit later. There are some distinctions, but it's helpful to know that worry itself represents feeling uneasy or being overly concerned about a specific situation. Your mind and body go into overdrive, and you constantly worry, what if and what might happen? Many teenagers who worry feel that they can prevent bad things from happening. There is a sense of impending doom that is felt. Worriers see everything as a potential threat, even if it's not threatening. But the fact is, when worrying becomes excessive, it can lead to feelings of higher anxiety with the likelihood of developing a physically disabling condition. Though not every teen worrier will go on to develop an anxiety disorder, a substantial number of teenagers do. The latest research indicates that approximately 8% of teenagers will experience what we would consider to be an anxiety disorder. Yet among these teens, only 18% will receive appropriate mental health care. What makes an anxiety disorder a disorder? Worry and its physical effects on the body become problematic when three situations occur, the first of which involves avoidance. Now, for teens, this might represent avoidance of substantial social relationships, avoidance of school, even some things as avoiding assignments, all because of anxiety. Now, we all in here may have avoided some assignments or public speaking, for example, at one point or another, but this anxiety or this avoidance specifically interferes. It gets in the way of their everyday functioning, meaning it impacts their routines. Teens aren't really doing the typical activities that they would usually do. And thirdly, these teens experience distress. Now, this distress can be psychological, a lot of excessive, repetitive, ruminative thoughts going on, or it can be emotional. Anxiety is really felt substantially within the body, and it's painful for many people. So an anxiety disorder really represents an umbrella term that refers to or covers 5 different conditions. Many of you might be familiar with these. The first of which is generalized anxiety disorder. Anyone know what that might refer to? This really refers to excessive worry about a number of significant life areas. What about social anxiety disorder? This represents a fear of scrutiny, fear of negative evaluations by others. Specific phobia is a little more condensed, representing significant fear and distress related to one particular object or situation. Panic disorder represents someone having excessive and recurrent panic attacks. And separation anxiety, although not often seen in teenagers, typically starts in childhood and represents difficulty separating from an attachment figure. So take a look. These are some of the common behaviors that we see in anxious teens. Do any of these look familiar or represent what you might be familiar with? Sometimes it's difficult to recognize these behaviors because anxiety itself is considered an internalizing disorder, which means that a person's actions are directed to themselves. Oftentimes we can't see the anxiety occurring. It's often hidden and difficult to pick up. Many of these youth will ask to stay home, especially when there's a significant event happening at school. Maybe a pep rally where they're going to be around a lot of people. Maybe it's giving a presentation in class, or even something like giving an exam. For some, there could be circumscribed incidences that are avoided, but others, it's different. Others exhibit anxiety through physical symptoms. Stomach aches, constant headaches, even muscle pain is often seen in these youth. One of the important points that I wanted to speak about was there's a difficulty tolerating uncertainty that comes with many youth with anxiety disorders. And what this represents is often the need to know what the outcome of future situations may be. And the difficulty of being a teenager is that anything can happen at any time and we can't predict outcomes. Other teens will be sort of the fly on the wall, wanting to just blend in and not be noticed. Now, many of you might be thinking, but doesn't every teen wish they weren't seen, want to be hidden from public view? But again, if we go back a few slides to what 3 components make an anxiety disorder a disorder, we would want to see that this youth would be avoiding significant life activities because of a fear of being noticed, of a fear of being scrutinized. Is anyone familiar with the last item, being a perfectionist? Always wanting to do things right, not wanting to mess up, fear of making a mistake. These behaviors all represent youth with anxiety. One of the more common behaviors that we see in teens with anxiety is avoidance. This is a big, big behavior that I want to emphasize because many people feel that by avoiding things that are hard, they don't have the responsibility anymore. It just gets easier. But in fact, for teens with anxiety, avoidance actually may lead to more anxiety in the future. Avoiding things feels really good in the moment. But yet, when faced with that same fear again, the anxiety will only increase and it will be more difficult to work through it. So avoidance can be one of the major ways that we've discussed earlier, which is not going to school on a day that there's an exam. Or avoidance can be a little more subtle. Let's say your teenager has a lot of fear about writing an essay on US history and will just procrastinate, get on YouTube, get on Facebook for a while. Even things like procrastination can represent forms of avoidance. It's difficulty initiating the task due to fear that they don't know how to do it. Avoidance may seem like a good coping strategy in the short term, but in the long term, it actually may be more detrimental. So some of the physical signs of anxiety that we commonly see in teens with anxiety difficulties includes some of the following. Now, it may not be all of them that your teen may experience, but it may be some. So some of the significant ones are, again, headaches, stomach aches, difficulty breathing, and this may or may not be in response to some specific anxiety trigger, like joining a social group, having to perform in a basketball game, but it could be. It's helpful to also know that there are some pretty common signs of general stress overload that we see in teens. Difficulty sleeping, your teen reporting that they are having difficulty falling asleep, potentially due to rumination about the things that they have to do or the things that they're afraid of. Difficulty sleeping through the night for the same worries. Chronic fatigue, feeling tired, feeling irritable in the morning. Irritability is something that we often see, particularly in teens with generalized anxiety disorder. Often, having too much stress in one's life, for adults included, may lead to a depleted immune system, which makes you more susceptible to getting colds and other illnesses. So hopefully you've got a pretty substantial background on how to recognize anxiety in teens. Now the big question is, what can you do about it? As parents, there's a lot that you can do. So I'll cover each of these in detail in the next few slides, but I always like to start with the don'ts. Don't accommodate anxiety. What does that mean? Sometimes it's hard to not accommodate your teen who's exhibiting a lot of stress, because that's what we want to do when someone's distressed and saying, I need help. You want to help them. You want to take away the thing that's causing the pain or causing the distress. Yet for kids who are anxious, taking away that stressor, again, represents a form of avoidance, which can, again, perpetuate the anxiety cycle. So oftentimes if you have a teen saying, I have a stomach ache, I don't want to go to school, but they're saying this maybe several times a week, and you accommodate them and allow them to stay at home, and it's because of anxiety, that's when the anxiety is becoming problematic. Not singling your teen out. Now this is an interesting one, because if you have a larger family, let's say, and the teen's anxiety becomes the major focus of issue in the family, that's going to maybe breed more anxiety. So we'll talk in a bit about some ways that you can normalize your teen's experience and help them be able to talk about it with you a little bit more. The third point under the don'ts is don't provide excessive reassurance. So again, if your teen is coming to you with a lot of distress, a lot of worry, what's going to happen to me later, Mom? What am I going to get on my test? I don't think I did very well. But they keep saying these thoughts over and over, and you continue to provide the same answers, and the same questions keep coming up, or maybe even more questions. I see some of you guys smiling. Maybe this is true for some of your teens. That again is a form of avoidance. That again prevents your teen from being able to really cope with the really difficult emotions that they're feeling. So what do you do then if you don't accommodate, you don't let them avoid, and you don't single them out? Be sensitive to their experience. Validate and acknowledge their experience of these really painful feelings, because they're very real for your teen. Listen, empathize, and try to understand as best as you can. And give positive feedback and praise about your teen's attempts to work through their anxiety or confront really uncomfortable situations or events. So one of the nice ways to respond to anxiety involves simply listening and providing just a little bit of reassurance by saying, I understand, I believe you. Believe it or not, those words they go a longer way than we think with teens. Trying to offer solutions too soon, however, may lead your teen to maybe become more anxious, but even push away. Modeling good acceptance of these feelings will also send a message to your teen that it's okay to cope with this, that these feelings are okay. They're not scary. You are your teen's biggest models. They take from your behaviors and they really learn from them. So if you stay calm in the midst of all of your teen stressors, they hopefully will recognize that they can too and feel a bit more empowered. So how many of you all, when you felt really, really worried about something going on in your life, maybe an event at work that you've had to do, and you've explained it to, let's say, your partner or a friend, and they said, don't worry about it. Everything will be fine. How have you felt? Sometimes it's okay, but often it sometimes doesn't feel like enough. So that's likely what your teen will feel if they hear the same words. Relax, it'll be okay. They won't believe you if you say that. So it's important to acknowledge that your teens, not tens, fears are very real. By empathizing, you really increase the chance that your teen will want to talk to you more about the anxiety and accept some of your guidance or solutions for solving the problems. So going back to my previous point about not accommodating anxiety, what do you do instead? Instead of allowing avoidance to happen, which is sometimes really tricky, you can try to set really firm yet consistent and caring boundaries about avoidance. So let's say this example is about a teen who doesn't want to take an exam. This is I'm imagining is a pretty common difficulty for teens. So this parent says, I know you don't want to go to school. I understand that this is hard. So again, that's validation and empathy. That's not starting out with, don't worry, it'll be fine, or what are you worried about anyway? You can state your concern. My concern is that if you avoid, it'll be harder to go to school later, so you're able to still get your point across. And then maybe you give them something to look forward to, yet still inherently saying, and you still have to go to school. It's a tough balance to maintain. The first part was to hopefully actively listen, acknowledge the feelings, and then you balance that with, and you still have to go, and then here's how I can try to help, or I can try to add a reward on there for you. Again, a really important point is to acknowledge your teen's effort, even no matter how small, at trying to work through distress. Whether it's they turn off the computer and they start to study, or you have a difficult time getting ready for school in the morning because they have an exam and they go anyway. Your words of acknowledgement and praise will go a long way. So maybe this slide should have been a little bit at the front. But I really want to emphasize that, again, as models for your teen, you engaging in self-care practices and really working to manage your own life stresses will really help your teen manage their own as well. It's important when your child is going through times of distress that you yourself are working to manage your own. Again, I know these 4 words at the bottom of the slide, stop, breathe, reflect, and problem solve, may seem so simple, but they mean more in the process of helping your teen manage his or her anxiety than you think. I would take a show of hands to say, how many of you are actively engaging in some solid self-care practices, taking that time for yourself? Great, I like the show of hands. This also models for your teen that it's okay to take a break. It's okay to do things that are pleasant or feel good in the context of managing really difficult emotions. Some folks will believe that if I bring up the idea of anxiety to my teen, it will make them more anxious. That's not entirely true. Education is power here. Education is key. The more accurate information that you relay to your teen, the better they will feel, the more empowered they will feel to be able to manage some of these difficulties. Once your child begins to understand exactly what's triggering their anxiety and that they can do something about it, they might feel more motivated to want to work through these really tough situations. What are some reasons it's important to talk to your teen about anxiety? It requires a great deal of bravery on your part, and to be quite honest, at first it might seem kind of lousy to approach these topics because they're stressful and your teen's under stress. Yet many teens don't really understand the processes that are going on in their bodies and in their mind, and you could help at least provide that first step to helping them understand. Many teens with anxiety feel that they're weird, something's wrong, that they might be going crazy because they have these excessive repetitive thoughts or they're avoiding other situations that their friends have no problems with. They focus more on the physical symptoms, the stomach aches, the headaches, the muscle and back pain, than other teens do. They don't know how to interpret it. Then this could lead them to feeling even more anxious. So the first step that we'll go over next is teach your teen about anxiety and how to recognize it. So I've broken down, to make it a bit more simple, about how to talk to your teen about anxiety. The first step, encourage your teen to open up about his or her fears and worries. So this is tough, and I'd like to encourage some participation to see if there are any other examples of how this can be done. So again, we've started with our reflective listening. You wanted to validate their experience. And sometimes in order to just approach the situation ever so gently, you can maybe join your teen while they're on the couch watching TV, maybe not when they're engaged in homework and actively worrying. You want to do this at a time where your teen is pretty calm and will therefore be more likely to receive your inquiry. So you could say something pretty subtly. I noticed yesterday that you didn't want to go to, or that you didn't go to your swim meet, that you said you were having a stomach ache. It seems like you've been having those a lot lately. What's going on? Or what's that like for you? To see if that's a way in to get them to talk to you. Would anybody use a slightly different approach? Something more direct? Are you feeling anxious about your swim meet? Why are you avoiding? You guys know your teens best, so you know the best way to talk to them. This is sort of just modeling the general approaches of validating, listening, and then just stating an observation ever so gently that you've had about their potentially anxious experience. Education, again, is key. Believe it or not, anxiety is very normal. We all have it to some degree. It's helpful to let your teen know that everybody else, especially teenagers, is experiencing anxiety as well. Anxiety, although it may feel really physically and psychologically uncomfortable, is not inherently dangerous. Rather, anxiety is very adaptive. It's something that we as humans have lived with for thousands of years. Many of you have probably heard of the fight, flight, or freeze, or the fight or flight approach, which really means that anxiety, in moderate amounts, can help propel us and keep us safe from danger. In modern day times, this may be us walking in a crosswalk and avoiding a car coming at us, or even in the process of driving, we're more alert and aware. Anxiety helps us have some forethought into the future to try to predict danger and other threats. And again, going back several slides before, this becomes detrimental in excess and when fears become irrational. I like to call this a smoke alarm or some sort of false alarm that anxiety is. It tells us that there's danger when there's really not. So one of the key parts of understanding anxiety is to really know what anxiety consists of. So we like to think that there are three parts to anxiety. There's what you think, or what you say to yourself in your mind. There's what you feel in your body. That could be rapid heart rate, sweaty palms, stomach aches, muscle tension, among the other things that we've seen earlier. And the third part is there's behaviors. That's what we do with our bodies, how we act when we're anxious. Typically, it's avoidance in youth with anxiety disorders. So an easy way to sort of explain this relationship is to draw a triangle with 3 different components. As you can see, these are the 3 components that we had on this slide. And this is really just meant to show you that there's an interrelationship between these 3 components. And sometimes it's helpful for your teen to really understand that your anxiety consists of 3 parts and they're all working together. When you feel a stomach ache, you might think to yourself, oh no, I'm getting sick, I need to miss class. And then you may actually miss class. This example here it's for a younger child experiencing a stomach ache and heart racing, thinking that their mother's going to leave them and never come home. And that leads to a lot of reassurance behaviors and just really calling out for their mother. So I won't go too much into detail about the specific strategies for helping your teen really deal with the worried thoughts, but this is just an example should you want to pursue any more information on this. So again, if we're thinking of specifically, let's say, generalized anxiety or even social anxiety, we know that there's an excessive fear that's present. So oftentimes these youth are thinking of the absolute worst outcome. They're always thinking of the negatives. So one way to maybe counter this as a parent is to try to help them develop a little bit more balanced thinking, maybe even helping them examine some evidence behind the thought that they're going to absolutely fail their math test when all they've received before is maybe straight A's. So again, this may be difficult to do, and oftentimes worried teens will say, no, I don't believe you. There's a big chance I will fail, right? So again, using that validation, listening, but not reassuring the anxiety, not reassuring the fact that you won't fail, you won't fail. Again, if your teen believed you that they wouldn't fail, they wouldn't continue to say, I'll fail, right? So one way you can try to do this is to say, how many other times have you failed before? What's the likelihood that you're going to fail this exam that you've gotten all A's in before? How can you manage these feelings that you're having and really try to emphasize handling the distress that they're experiencing, not trying to run away from it? Remember, because it's not dangerous. It just feels really, really difficult to deal with in the moment. So we call that balanced or irrational thinking. So some of the questions to consider as to whether or not you perhaps should seek additional services or get help, period, for your teen are some of these. Is your teen worrying a little bit more than other teens? Maybe not a little bit more. Is your teen worrying a lot more than other teens that you know? Now, this might be tough because we live in an area in which being very, active in activities, being very studious is the norm. So how can you gauge whether or not your teen is worrying too much about, let's say, grades or even social activities than others? That's difficult. And so sometimes it's helpful to, seek additional help or to ask some of these other questions. Again, are they avoiding? Are they being taken out of the typical things that maybe they used to do or that you see the neighbor down the street doing? And are they presenting to you as if if they're in a lot of distress? Most of the day, nearly every day. Are they worrying a lot? Are they having any physical symptoms? Are they having difficulty concentrating on work when maybe before this wasn't ever a problem? So really looking for behavioral changes, drastic changes in their routine and everyday functioning. So the good news is that we have very good treatments for teenage anxiety. The gold standard treatment, and one of the most well-researched, is what we call cognitive behavioral therapy. So what cognitive behavioral therapy involves is active collaborative work with your teen. It involves examining that triangular relationship, looking at thinking, feelings, how everything's working together to produce perhaps some avoidance behavior. Parents and schools are a big component of cognitive behavioral therapy. You are your teen's best coach because you really have the most access to them where this anxiety is occurring. CBT, as we call cognitive behavioral therapy, also involves a lot of active work with a therapist in facing the fears, facing the very situations that make your teen nervous. Oftentimes, treatment may involve medication This may be for more serious anxiety, or it may be when your teen doesn't respond to, let's say, a typical psychotherapeutic approach. A very effective medication is selective serotonin reuptake inhibitors, Prozac, Zoloft, or Common, many have heard of. So the good news is that there are some ways to help your teen manage anxiety. We have great research on a number of treatments that have been effective. If the anxiety might not represent something that's a disorder or excessive, even small changes in routine, promoting self-care, getting more sleep even, can make a substantial difference. Importantly, social supports, having a nice network of friends, both for your teen and even for yourselves, in managing these difficulties can be very helpful. Through an active identification of what's causing this anxiety, what's triggering these fears, can help your teen become motivated to work through them. So I'll end with just some resources should you be interested in learning more about cognitive behavior therapy or learning more about anxiety in teens.
Okay, so we're going to continue on from what Dr. Berry has set us off on a nice course on and talking about anxiety in teens, to talk a little bit more about other types of intense emotion. So we've been talking about what it might look like when your teen has shut down or is avoiding things. Now we're going to talk about sort of the other end of that spectrum when you see the meltdowns, the outbursts, or other types of those intense emotional presentations. So when you have your teen or other important teens in your life in mind and you think about the intense emotions that are driving them crazy or the intense emotions that are driving you crazy, which ones do you think of? Throw some out there. I'm sorry? Anger? Anger, okay, absolutely, anger. What else? A rebellious attitude, yes, absolutely. Those tend to be the ones that drive the parents crazy more, right? What else? Sarcasm. Mm-hmm. Yeah, feelings of lack of appreciation. You're working like crazy for this teen and they're not seeing it. Yeah, what else? We can't have that many easy teens out here, right? Didn't get you in your cars to come out here tonight because your teens are so easy. What else? What else are people seeing? Moodiness, absolutely. Stubbornness, yeah. So notice some themes here, right? Moodiness, stubbornness, anger, feeling unappreciative. Common theme around all of this, right, is a negative emotionality. I don't hear people say, oh, you know, she's just so happy, it's too much for me, I can't handle it, right? And this is something that is universal for all people, not just for teens, that we have aversion to negative emotion. And if we could get rid of all that negative emotion, would we do it? I want you to hold on to that thought as we just take a little pause here to talk about what it looks like in adolescence. So historically, we've talked about adolescence as this time of storm, of intense emotional dysregulation. And this was how we thought about adolescence for decades. And now, emergent, a lot of research is suggesting that this is not necessarily the case all the time for teens. It's the moments that stand out. They're the ones that are salient to us, right? The ones that are particularly distressing. But adolescence also is a time of resilience. So there's a lot of effective coping that goes on in getting through these difficult situations. That being said, feeling intense negative emotion is common. So when adolescents are asked in research studies to carry around a phone with them or a pager and they're asked to respond on random moments, what emotion are you feeling? When they are asked to respond over a couple-week period, 50% of them will say that they felt depressed. Now that doesn't mean it's rising to the level of what we talk about as a clinical depression, of something that we would necessarily be treating in an outpatient clinic. But it is to say that feeling down, feeling sad, feeling irritable and upset like that is a very common teen experience. And 11% of teens will go on to experience a clinical depression before the age of 18. And we'll talk a little bit about what that looks like. But more broadly, we're going to talk about intense emotion in general and how to help teens to cope with that and how to manage that for yourself, because oftentimes it's impacting us, right, just as much as it's impacting the teens. So going back to these intense emotions that people had named, this anger, sadness, fear, if you look at all of these intense emotions up here, what kind of problems get created with these emotions? What kinds of things do you see happen when teens are feeling these intense emotions? No, fights, absolutely. Fights between siblings, fights in families, fights with their peers, fights with boyfriends and girlfriends. Yeah, absolutely. What else? Low self-esteem, yes. They start feeling badly about themselves, absolutely. What other kinds of things?
Separation from the rest of the family?
Sure. So they start to withdraw often, to separate themselves. And that can create a lot of stress for other family members and for the family unit. So a lot of problems that get created, these fights, the low self-esteem, the withdrawal. So if we could take all of this negative emotion, these strong, intense emotions, and we could get rid of them. If I told you, hey, we've got the technique, we've developed it here at Stanford, bring your teen in, we're going to remove it. We're going to get rid of this intense emotion. Would you sign your teen up? Show of hands. Yes, right there, from the line, I'm going to sign my teen up. All right, one brave soul is going to be experimental on this. Those who didn't raise their hand, why not? Why wouldn't you sign your teen up for this? Okay, so there's something that can be good about these feelings. Absolutely, absolutely. So that is the number one reason that we're not going to get rid of them. A couple of others, though. Oftentimes, that is the first approach that we go to, right? These feelings are so intense and so overwhelming, so painful, that not just teens, but adults as well will try to do anything that they can to get rid of it, right? You turn on the TV, you get on the video games, you do whatever you can do to zone out. And the number one thing that people will use, right, is suppression. They try to get rid of it. Here's what happens, though, if you suppress. And everybody to put down pens for a moment and try this experiment with me. This is a now classic experiment that was created by Wagner a few decades back. So I want you now for the next 30 seconds to think about anything you want. You may think about anything. Just do not think about a white bear. No white bears. Anything else. Go. Okay, how many people had a white bear pop into their head? How many people had thought about a white bear before I showed this slide or started talking about white bears? Right? We call this the rebound effect. When we try to suppress something, it actually comes back at us even more intensely. And how much effort did it take you to try to get that white bear out of your head, to try to think about something else? Did you notice yourself having to kind of apply effort to that process? So not only do you get this rebound where it actually creates more thoughts about it, but it's really effortful. Imagine trying to study for an exam, right, while you're actively thinking, no white bear, no white bear, no white bear. Same thing if you're trying to think, don't be sad about that, don't be angry about that. Try to push emotion out of your head. The second problem that comes up is that we can't selectively get rid of emotion. Right? We want to pluck out that anger or that sadness and say, I don't want to feel that one, but the happiness, I want to keep that one. That one's feeling pretty good. And it doesn't work that way. We're not wired that way. So when people start trying to shut down their emotions, when teens say, you know, well, I've been getting in so much trouble, or people feel upset with me when I'm feeling down, so I'm not going to feel it anymore. I'm not going to have sadness anymore. They end up not having anything anymore. And they get to a place where they're really numbed out. Anyone seen that in your own teens or other teens where there just isn't really any emotion? They're just kind of shut down? Often that can be a result of trying to not feel something in particular. But the third piece, which you guys nicely labeled for me right off the bat, is that there is function to these emotions. We need them. So even if we could get rid of them, which we've already established is really tough to do and not really doable, they serve a purpose for us. And there's 3 key ones that I've got up here. So the number 1 is that emotion motivates us to action. And it communicates both to ourselves and to other people. So I want you to imagine right now that there's a fire in this room, okay? And I need you all to leave the room. But I have no emotion. I can't use any emotion, right? Excuse me, I would like to have everyone's attention. There is a fire in the room. Could everyone please leave? How motivated do you feel to jump up and get out of here, right? Whereas if I say to you, everyone, there's a fire, please proceed immediately to the exit, right? It alerts you. It alerts you that there is something going on that you need to attend to. It gets you motivated. It gets you activated. So teens need these negative emotions. They need the anger. They need the sadness, even the sarcasm, the other components that you're talking about that can be really difficult to deal with. They tell you that there's something important that's going on. So part of what we do in dealing with difficult emotion is to actually shift the way we're relating to it, shift the way we're thinking about it. Habitually, we get to a place where it's so exhausting dealing with these negative emotions, we start viewing them as the problem. So a first fundamental shift is to a place of saying that emotion is not the enemy. And to start asking yourself, if your teen is dysregulated, what function does this emotion serve? To get curious about it. What's going on here, right? Now, this is hard to do. It's hard to do because we have our own strong reactions to other people's strong emotions. So there's a stepping back that has to happen here. The second part of it is to assume that there is a meaningful function to it, right? So we can say to ourselves, well, what's the point of this one, right? We're asking what the function is, but not really in that open, curious way. So we're trying to find that open, curious stance and to teach our teens to do the same thing, to be curious about their own emotions. Anyone seen this cycle get going with their teen, right? Where they feel angry, they feel upset, they have an outburst. Then they kind of get embarrassed and they realize that it was a little over the top. Then they get down on themselves, they start feeling badly about that happening, and a vicious cycle gets going. So part of what we want to do is not layer negative emotion on top of negative emotion on top of negative emotion, but to start with recognizing that first one and ask, well, how come I'm feeling that? There was a good reason for it. What was it? Okay, how many of you are sitting there going, yeah, that's all well and good, but not my teen, or my sister's teen, or the teen in my classroom, or whatever teen you're interacting with that you say, that particular teen, that's not functional emotion. That's a problem. Anyone seen a teen like that in their life? Okay, so in that case, can we say, well, now we have to get rid of the emotion? Now we've got a problem. Now we've got a problem we've got to get rid of. For that particular teen, we're going to get rid of this emotion. How many people signing up for that? For some teens, we need to get rid of their emotion. I'm going to argue no. That we actually get into this trap that with teens who have really intense dysregulated emotions, we put it in a different category and we say this emotion isn't valid. But in fact, there is something that's caused that emotion and there is something valid about it. There's just an intensity to it, or a duration of it, or a reactivity that is making it not fit the situation that causes us to label it as problematic. And yes, we want to help teens with how to be more effective in modulating their emotion, but we still want to start from that same baseline place of assuming that the emotion has a validity to it, There's a purpose to it. So we talk, in some cases, within dialectical behavior therapy, we'll talk about teens that have strong emotion sensitivity. So these are the teens who feel emotions intensely. They're not a little bit angry, they're royally pissed off when something happens, right? And it doesn't kind of start to build, it's boom. It just happens, it's right there. And it's not, an hour later they're over it. At the end of the same week, you can still hear the same issue coming up, right? Those are three components that we talk about in terms of emotion sensitivity. When you encounter teens who have emotion sensitivity, our culture's got judgment about emotion sensitivity. What kind of judgments do you hear come up about being emotionally sensitive, or about having a teen who's emotionally sensitive, or that we might even fall into making ourselves? What kinds of things do your teens come home saying they hear other kids saying to them if they are emotionally sensitive? You're mean. You're mean. Absolutely. What else?
Someone said drama queen.
Drama queen. Oh, yeah, that's a popular one, right? You're such a drama queen. What else? You're spoiled. You're spoiled. You're so sensitive. Just chill. You just relax. Right? These teens have to hear a lot of these kinds of messages. And it does create problems, as we've identified, right, in relationships and in being able to get through other tasks when there's a tense emotion coming up. But there's also something that can be good about being emotion sensitive. What's positive about being emotion sensitive?
Sensitive to others.
Absolutely, right? These are teens who are often very empathic. They can read the room. They can pick up what's going on. They can put themselves in someone else's shoes. That's a strength. What else? What are other strengths of being emotion sensitive?
Well, they are communicating with you. They are telling you.
Sure, absolutely. So they're engaging, they're interactive. There's a liveliness to it, right? People who are emotion sensitive, teens who are emotion sensitive, are often ones that are actually really fun to be around. Maybe not in the moment of certain intense emotions, right? But they're so alive and so engaged in life. There's a passion, kind of a zest for life that comes with being emotion sensitive. Oftentimes, these are teens who are particularly creative, artistic, good musicians, good writers. There comes from some of even those darker, more intense emotions. So there's a lot that can be positive around this, and this is the kind of what we want to help teens to start to understand about themselves if they are emotion sensitive, that it's not all a bad thing. One of the ways we like to talk about it is to think about a racehorse metaphor. And that is that being emotion sensitive, being someone who's prone to strong, intense emotion, is kind of like owning a racehorse. If you've never ridden a racehorse before, what happens the first time you get on? You're on your butt, right? It's going to throw you off in 2 seconds. But if you can skillfully learn to ride, then a racehorse is going to be so much more exciting than a pasture pony, right? This is a great ride. And that's what we want to help teens to think about, that being prone to having strong, intense emotion can be a great thing as long as you've got skills to be able to utilize it effectively. And that's where we want to come in to help teens to be able to get those skills to utilize these strong emotions. So here's one approach to being able to manage intense emotions, and we'll go through each of these parts. But the first piece of it is just being able to pause and recognize that there's a strong emotion there. So here's a variety of strategies to pause, right? When a teen or anyone else is in the middle of a really strong, intense emotion, they're having a meltdown, they're really angry, they're screaming at you, or they're shut down, they're really depressed, they're really sad, they're caught up, they're on the train, so to speak, of that intense emotion. And to be able to do anything else, to be able to interact with you and have a reasonable conversation, to problem solve, to figure out what to do. We've already agreed there's a function to this emotion. There's something important that it's telling us. We want to problem solve the situation that's created it for them. But in order to do that, we first have to be able to step back from it, because you can't problem solve when you're in the midst of it. So the first thing to do is to recognize it's going on. So that can be to stop talking, right? And these are things that you can be doing when you're interacting with your teen who's in that intense emotion state as well. To stand back in a metaphorical sense from it and try to watch what's going on, or to physically step back from the interaction. Take a breath, observe kind of what's happening. The second part is to name the emotion. A lot of teens actually lack emotion vocabulary when it comes to describing what's going on for them. So when they're in the midst of this kind of place of meltdown where they just feel completely overwhelmed by intense emotion, they may not even be able to say, well, I'm actually really feeling angry, or I'm really hurt by this. They just know they feel terrible. Everything feels not okay. Everything feels like it's the end of the world. But being able to problem solve effectively around emotion requires being able to identify first what emotion's there, what's going on. And that may involve elements of helping teens to be able to understand their unique reactions in terms of the physiological sensations. And this should sound familiar, right? Because this is a piece of what Dr. Berry was talking about when she's talking about anxiety. So physiological cues that come up for them when they're feeling angry, that their fists may tense up, or they may get red in the face, or if they're feeling anxious, it may be butterflies in their stomach. Starting to identify what are common thoughts that go along with different emotion states, and what are the action urges. Right? When I have the urge to run out of the room or the urge to hide, that tells me that it might be cueing me I may be feeling anxious. Right? Whereas when I have the urge to attack, that tells me probably I'm feeling angry about the situation. A key to this is non-judgment. So again, we don't want to get into that loop where we're judging the emotion that we're having and then it's creating a negative emotion on top of the initial one. So it's standing back in a neutral kind of way, and one of the very trendy approaches right now is around mindfulness and observing kind of what is in the moment. This is a way of non-judgmentally looking at what's happening. You also need to have a language to be able to communicate about what the teen is experiencing, both for them to be able to communicate to themselves and to be able to communicate to you. So when they're feeling really, really upset, right, what does that mean, right? Especially if you have a teen who expresses him or herself in an intense manner. One of the ways to be able to understand what exactly does a teen mean when they're really, really angry or they're really, really hurt or sad about something is to be able to have anchor points together to be able to say, well, how does this compare to something else, right? So if you and your teen in a moment when things are in a calm place can together agree on, well, a 0 for you, when you're not feeling any anger, you're not feeling any sadness, or there isn't any intensity of this emotion, might be when you're playing video games or whatever it is that that teen particularly likes to do that has them at a state of kind of total relaxation. And then to think about a time that was a 10, the time that their best friend decided they didn't want to be friends anymore. And they were really, really upset, a time that they bombed the SATs. Whatever it is that was just a peak experience of this was a 10, this was really, really, really awful. And then find something kind of halfway in between that you'd say, well, this is about a 5. So that then if your teen is coming to you and is trying to get you to understand just how much this bothers them, and you feel like you've heard this a million times before, they can say to you, no, this is a 9. I'm a 9 right now. And that helps you if 10 was failing the SATs and it was the most devastated that you ever saw them. Okay, they're really upset because maybe it sounds each time like they're equally upset. And it helps them to be able to communicate to you in a way where they're talking about this titration of the intensity of the emotion, which helps you to be able to respond more effectively. Because okay, if I only sometimes get the message this is a 9, then I know to really tune in and amp up on this one. Now, no one can think when they're at a 10. When we're at a level 10, it actually shuts off cognition. And that's for good reason. It's evolutionary adaptive, as Dr. Berry was talking about, right? That when we're at a really high level of emotion, It's for the purpose of doing exactly what you need to do in that moment for survival, right? To fight, to run. But in these situations, it's not effective. Most of the time of what we're dealing with teens, it's not effective to be at a level 10. And so you need to help a teen to be able to reduce that initial intensity of emotion before you can do anything else. So do not approach a teen that's at a level 10 and try to have a conversation about anything. It's not going to happen, right? It's not going to be effective. It's like if you are trying to parallel park your car and someone's trying to teach you calculus in the middle of it. You're distracted. You can't focus. It's not going to be a good time to take it in. Same thing if a teen is at a level 10 in terms of the intensity of their emotion. So there are a variety of strategies that we can teach teens about what to do to reduce the intensity of that emotion so that they're then available to do some problem solving with you and to think about what's the function of this emotion and what do we want to do with it. And this comes out of Marshall Linehan's DBT, dialectical behavior therapy approach. And it's the kind of thing that when teens first hear it, they think that's the stupidest thing I've ever heard. But if you can get them to try it, they're pretty impressed with how well it works. So the first one, the T, stands for temperature. And that's about just shocking your body system to change the physiology. So if a teen is at a level 10 of anger, they're really, really upset, if you can get them to take something cold from the fridge, or better yet, the freezer, right, that bag of frozen peas, and just stick it on their face, just for a couple of seconds, it will drop the intensity of that emotion. It actually comes out of research that marine biologists were doing with seals, and they call it the dive reflex. So when a seal dives deep into the water, it needs to slow down its heart rate in order to go deep. And the way that that is triggered is the cold water hitting the seal's face is actually what triggers that response to slow the heart rate and bring down physiology. So you can trigger that same dive reflex by putting your own face into a bucket of cold water or splashing cold water on your face or putting something cold from the fridge or freezer against your face. It actually starts to reduce the physiological arousal in your body. So it brings you down off of that level 10. It's quick. It's something that you can do, without having to have conversation about it or a lot of thought. So again, it's the kind of thing that sounds really odd to people until they've tried it. So see if you can get a teen. I challenge you to get a teen to try it out, and that probably means trying it out yourself, right? So that you believe that it actually works. So cold temperature is particularly good for anger. Warm temperature can be particularly good for anxiety. Those kind of hot showers can often be really helpful to soothe, or hot bath. A second skill is intense exercise. And this doesn't mean go to the gym, although absolutely when it comes to negative emotion and depression in particular, exercise can be a standalone intervention for depression. For mild depression, it can be effective. Exercise alone can be an effective intervention. But we're not talking about going to the gym or going out for a run or doing an hour-long exercise in this case. We're talking again about trying to get that burst that changes physiology. We're just trying to drop off a 10. If we can drop down to an 8, that creates a little bit of space to be able to think, to be able to problem solve, to be able to come up with the next plan. So the intense exercise is really like drop and do 10 push-ups or do 10 jumping jacks. It's just something really quick. Run up and down the stairs a couple of times. It's a brief burst to change the physiology in your body. And then the third here is progressive muscle relaxation. Is that something that's familiar to people? This is basically going through a relaxation exercise where you take individual muscle groups in your body and you tense them up. So tensing my arms, my fists, and holding that for 5 or 10 seconds before you release it. The purpose of that, everybody try this along with me. So take your fists, your arms, squeeze all the way through as tight as you can, and then release it. So we could go through all of the muscle groups of the body, and what you find is that it's really hard to say to someone, well, just relax your arms, just relax. We don't really have a cue to send to our muscles to say, just relax. It's actually a lot easier to do it in opposition. So if you tense your muscles and then release that, it's easier to actually get the sensation of relaxation. So this is also something that can be done quickly. You can do it in a more extended format where you're taking 20 minutes to really relax your body, which is great for insomnia for teens to do right before bed or right before a test when they're really stressed out. But you can also do it in a few seconds in the car, right? You can just do it with tensing up your leg muscles or tensing up your arm muscles for a few seconds to just get that little shift. So once you've gotten down off of that level 10, the next thing to do is to validate your emotion. And that's going back to this place where we're assuming that there is a function for it, there's a reason for it, and it's okay to feel this way. So we want to differentiate for teens the difference between emotion and behavior. There are behaviors that may not be acceptable in your family or in the school or in other public settings, and there may be consequences of those behaviors, but that is different than the emotion, right? So my throwing a temper tantrum, there may be a consequence for, but my feeling angry, that's valid. I perceived something that I think was unfair, that upset me, and it's okay that I feel angry. But oftentimes this message has gotten confused for teens, where they start to get the message that there's something wrong with their emotion because of these messages like, oh, you're such a drama queen, you take things so personally, or the reactions that they get when they express the emotion in an ineffective way. So I want to teach teens to validate themselves, which is telling yourself that your feelings or your thoughts are okay. And this is a biggie for parents or any others are interacting with teens. You want to really practice this skill of communicating that you understand their emotion and that it makes sense. Sometimes you got to dig deep for this one, right? Because in the moment, sometimes you're thinking, this is not reasonable, and it does not make sense. So you may have had to do some of your own stepping back, taking a deep breath, using a tip skill yourself so you can bring your best problem-solving mind to the situation with them. So here's how you validate with a teen. The first thing is you pay attention. Anyone ever had this scenario? Here I am in the kitchen, right? And I'm getting dinner ready, and I've got my teen back here who's saying, Mom, can I talk to you about something? Yeah, sure, no problem. What's up, right? Who's ever done that before? We've all been there, right? We've got a million things going on, and we're trying to multitask. But a first part of validation for a teen, right, or for anyone, is showing that you're paying attention. If your back is to them, or if you're doing another task at the same time, you're not communicating that you're paying attention. So it means actually physically putting down what you're doing. And a big piece of this comes down to timing as well. So you may, with your teen at a time when things are calm, want to talk about how you establish effective ways to ask for the conversation that they need about something that's bothering them. So if your teen comes to you and you are in the middle of making dinner and they say to you, Dad, this is really important. I really need to talk to you. You can let them know, I'm in the middle of dinner right now. Can it wait until after? And I will set aside some time for us to just sit down and talk about this. Sounds like it's really important and I want to give you my full attention. And that sends, oftentimes, teens are used to, you try to multitask, that sends a different message of like, hey, I hear you. This is really important. I want to give my full attention to it. Can we set up a time? If you set that time up, what do you have to do? Follow through, right? Teens are on it. The first time you say that and you don't follow through, you've lost your credibility, right? So if you set up that time, especially early on, if this is a new pattern you're trying to set up with a teen, doesn't matter what comes up, you got to follow through in that time that you set up. Second thing is around the words you use and the body language that you use, right? So if you've been down this road and you've heard this story a million times before, there are a lot of involuntary things that we do without even worrying about it. We check our watch, right? Okay, how long is it going to take? Because I got to make sure that I put the other kids to bed, right? Teens are on this, right? They're monitoring everything you do. That brief glance at your wrist, done. You lost them. That's invalidating. So you've really got to be mindful of paying attention to what you're communicating to them non-verbally. You want to look for a word that describes what they're feeling without judging it. So you're really angry. No, I'm not angry. I'm not angry. Okay, you're not angry. I didn't get it. Okay, tell me again. I said that I wanted to kill her. Oh, so you're so pissed off that you wanted to kill her. Yes. Okay. Once you got the yes, you know you're on the right track. If you don't have the yes, keep going. Keep looking for it. You haven't gotten it yet, right? You want to communicate that you understand and that it makes sense. So this is about putting yourself in your teen's shoes and trying to figure out, using your best, curious, neutral detective mind to say, okay, how is it that this makes sense? We've already agreed. We've already agreed that emotions have function, so it does make sense. We're not trying to figure out, does it or doesn't it? It does. So I'm taking one thing off your plate. That's easy. It makes sense. You just got to figure out how it makes sense. So look for any element that you can say is valid. So maybe it's about the history, right? So maybe your teen is complaining about an interaction in which he felt that he was getting overly teased by one of the siblings, right? And you're like, oh, this was not a big deal, right? This really wasn't a big deal. Are we going down this road again, right? But if this is a teen who historically has been bullied, or is the kid in the family who is maybe just personality-wise different from everyone else and feels often a little left out or often a little like he just doesn't fit, right? Then maybe that makes sense that he's extra sensitive to the messages from other siblings. And you can get in his shoes in that way. So even though you may say, well, okay, I don't really agree with the reaction to this situation, you can get that based on what he's been through before, it makes sense. And that's what you want to validate. You want to find the part that's valid, that you say, yep, that makes sense, and you want to communicate that to your teen. And then the last part of this is that you want to figure out what it is that the teen needs in that moment. And it's okay to ask, right? Sometimes it's hard to know. Are we just venting right now? Do you just want to vent? Or am I supposed to come up with a solution? Am I supposed to problem solve, right? You can be dancing on your toes trying to figure out what it is a teen needs because it's changing all the time, or you thought that they wanted to just vent about it. Now they're asking, well, why aren't you helping me, right? So you can circumvent this by just asking right at the outset, okay, do you want my help problem solving, or are you just venting? I just want to vent. Okay, great. Then get yourself in listening mode. You're off the hook to problem solve. Don't even try to go there. Even if you've got 20 great solutions, they've told you right up front, they're not interested, it's not the right time. Maybe later they'll give you that opportunity, but you gotta wait until they're looking for it. Key part to remember here is that validation is not agreement. So this is where parents and other adults can often get stuck with validating, because you may fundamentally disagree with your teen's perspective on a situation. Everyone should remember, it's not that you're saying, yeah, that's right, I agree with it. It's just that you can see where they're coming from. You get that from the way that they're looking at it, it makes sense. And that's what you're trying to find. So if we're moving on to this problem-solving place, and remember, we're not moving on to that problem-solving place unless we've gone through all of these other steps to be able to get down to a less intense level of emotion, and that a teen's communicated that they're open to problem-solving. There's a number of steps that we might go through. And the goal here with problem-solving is to deal with situations as they come up, so we're not getting this compounding effect where there are stressors on top of stressors. So you can actually help teens through this process if they're saying that they do want to problem solve by having them identify the problem out loud. So actually state what it is. I have a test on Friday, and I don't feel like I've prepared for it, and I don't feel I have time to study tonight because I have 3 other assignments. Okay? That's a statement of the problem. Oftentimes, what you get from teens instead is what? It's too much, I can't handle it, I can't deal with this, I can't cope anymore, I'm done, I can't do it, right? You have no idea what the actual problem is there. You can see the distress, but you have no idea. How would you jump in to problem solve that, right? So you want to get things down to a place where you've really got some concrete facts on exactly what the problem is, so you know what it is that you're trying to solve. Then you want to help them brainstorm, coming up with all the different solutions that they can. And in this phase, you don't want to censor anything. Any possible solutions, even ones that seem ridiculous, impossible, can't be done, it kind of gets the creative juices going. So throw out any possibilities that they can come up with. And then you'll go through them and help them evaluate what are the pros and cons of those different types of options, and ask them to pick the one that they think is best. Often the tough part with this is that none of them is just right. They're looking for that perfect solution, right? And there isn't a perfect solution to it, or they would have already grabbed that perfect solution themselves. So it's helping them to see that there isn't a perfect solution, but you got to go with one. Pick the one that you think's best, and in your mind, say yes to it. So be open to it. Okay, this isn't perfect, but I'm going to go with it. And then try it out. So validate yourself for having picked one and try it out. So this is a variety of strategies to deal with intense emotion in teens. When do you know you need something more? One is just when the strategies aren't working, when you're trying it but it doesn't seem to be going anywhere. Or if both you or your teen is interested in some more support or some more skills. I'm going to touch on just briefly some signs of depression and bipolar disorder, which would also be an indication that it might be time to look for some professional help. And suicidal thoughts or self-harm behaviors. So I have up here the common symptoms and signs of depression in teens, and it can look in a variety of different ways. So you notice that there's sadness and tearfulness, but there's also anger and irritability. There's also flat and numb kind of emotion or affect. So that predominant way that a teen presents could look, tearful and sad. It could look angry and irritable. It could look just kind of numbed out and not feeling anything. Any one of those could be a sign of depression. And you're also looking for some of these changes in terms of engagement and activities that they enjoyed, some changes in sleep, in appetite, in how they're feeling about themselves, self-esteem, concentration, performance in school, and expression about thoughts about suicide. At the other end of the spectrum with bipolar disorder, you're looking for periods of time when a teen may feel kind of the opposite, sort of on top of the world, really high, hyper excited to a level that's beyond what their usual level is. And it comes along with a variety of other behaviors that can get in the way and cause difficulties. And I'm happy to talk more about this as people have questions, but I want to make sure we leave some time for discussion. So I'm going to just touch briefly on suicidal thoughts and self-harming behavior, which is something that we see more and more from adolescents. Used to be something that we attributed with more extreme kinds of clinical conditions, and these days it's actually something that teens are encountering commonly in their high schools. Often know someone who has felt suicidal before or engages in some kind of self-harm behavior like cutting themselves or burning themselves. So suicide's the third leading cause of death in youth, and it's something that, of course, we always want to take seriously. Oftentimes, adults are afraid to ask about it because they're afraid of putting something in a teen's head if they hadn't thought about suicide before it. That's not going to happen. So you don't have to worry about putting an idea in their head, and you do want to ask if teens are having thoughts of suicide, if they have a plan, if they intend to carry it out, how they're thinking about going about doing that. And you want to express directly that under no circumstance do you want them killing themselves. That's one of those things that parents think, well, of course their teen knows that. And you would be amazed at the number of teens who have really involved, loving, caring parents who truly believe when they're in that moment of depression that no one would care or that their family would be better off. So don't assume that they know that you feel that way. Actually tell them that if you have a teen who's struggling with thoughts about suicide. So here's a place where you do want to step in and seek some professional help in helping to come up with safety plans or take a teen emergency room if they're having suicidal thoughts and you're concerned at all about their safety. I want to differentiate this, though, from ways that teens can ineffectively talk about suicidal thoughts. And that is when you get teens saying things like, "I'm going to die if you don't let me go out on Friday." There is no point to my life if I can't date her. I can't live if you don't let me do this, right? Sometimes teens pair messages about things that are really serious, like suicide, in a way to try to get you to understand just how strongly they feel about something. And you want to help teens to disentangle those messages. And one way to do that is to respond directly to the message about suicide. So when a teen says, I'm going to kill myself if you don't let me do X, what do they want you to do? React. Specifically, how do they want you to react? What would they actually like you to do in that instance? If you don't let me go out with my friends on Friday, I don't even want to live. That's right. Let them go out with their friends, right? Or even get in the discussion about going out with friends. And the way to circumvent this is if they've said, I'm going to die or I'm going to kill myself if you don't let me do this, respond to the message about I'm going to die or kill myself. Really? Are you serious? I'm very concerned about that. If you're thinking about killing yourself, I want to take some steps to make sure you're safe. Let's call the doctor first thing in the morning. Let's bring you into the hospital. Let's make sure that this doesn't happen. I don't want to lose you, right? If the message was really, no, I just really, really want to go out on Friday night, you'll have your teen backing down quickly. No, we don't need to go to the emergency room. It's not that. I just really want to go. Oh, you're just trying to let me know how strongly you really want to go. You know what? If you can just let me know that directly, I'm happy to have the conversation about that. Doesn't mean you're going to let them go, right? But that's what's going to get them entry into talking about whether or not they can go out Friday night. If they're pairing it with a message of suicide, just respond to that message. Because if that's really what the message is, that's where you want to be responding anyway. And if that wasn't the message, they're quickly going to shift position on that. Make sense? Okay. So overall, both for anxiety disorders and also for mood disorder or other presentations of intense emotion, mental health professionals vary in how they treat these particular disorders. And Dr. Berry mentioned cognitive behavioral therapy, so that's a good buzzword to know if you're looking for a health professional to treat a teen. Other kinds of approaches with evidence-based behind them are dialectical behavior therapy, acceptance and commitment therapy. You want to ask questions about the type of treatment that professionals are utilizing and how they're planning to address the anxiety or mood difficulties. This is something that I think we often don't educate the public about well, that it's okay to shop for a therapist. You don't have to just take the first therapist that you're offered. It needs to be a good fit, and it's okay to ask them about their background or their training or how they see these problems or how they approach treating them, and make sure that it sounds like it makes sense to you, that it resonates, that you think, yeah, okay, they seem to know what they're talking about.